Welcome to yet another exciting topic under Zaumoyo program. Today we are discussing a topic called fistula. I am your host, Jubel Zulu. Fistulas in Zambia are still a devastating problem for impoverished young mothers despite being preventable. And without treatment, fistulas can mean a woman will leak urine, stool, or sometimes both for a lifetime. And Ministry of Health and other stakeholders such as the Fistula Foundation and other organizations seek to help women suffering from fistulas in Zambia. To understand issues surrounding this condition, today I am joined by a special doctor. Doctor, welcome to this program.
Thank you very much.
You can please introduce yourself.
I'm Dr. Abraham Mwape, an obstetrician gynecologist at Chipata Central Hospital. So I deal with women's health, reproductive health, and basically labor and delivery. That's my area of expertise.
Okay. Now, when we talk about fistula, what is fistula?
All right. So to understand this problem, in simple terms, fistula, it's a scientific word to mean a connection or a communication between two spaces, between two organs, which should not be there. It wasn't meant for it to be there, but for some reason it forms, causing a connection between two areas. In simple terms, that's what a fistula will be. Then with specificity to my professional, we're going to also have what we call obstetric fistulas. Now these obstetric fistulas, these are fistulas which will be related to childbirth. So obstetric fistulas are fistulas which will be as a result of injury during childbirth, and are going to result into what you mentioned earlier, incontinence. That's incontinence of stool and urine. So the result there is you're going to have discharge of either stool or urine or both through the vagina.
What are some of the notable causes? I know you have spoken about, childbirth and all that, but are there some of the notable causes of fistula for one to just have this condition?
Some of the causes will be, of course, as I earlier mentioned, childbirth. Trauma in childbirth, injury that is going to be caused during childbirth is going to cause a fistula in a woman around the genital tract. So other causes will be infection. This is where the underlying infection is going to weaken the tissue of these areas where the fistula is going to form. Secondly, we have causes, congenital causes. These are conditions which you're born with. You're just born with a fistula, though very, very few in numbers as far as prevalence. That will be one cause. Another notable cause will be malignancy, cancers. Cancers will tend to cause this abnormal connection, this channel I'm talking about between two different organs. So both, just as a disease, cancer itself, it is able to bore a channel through these tissues to cause this abnormal connection. Then secondly, also therapeutic methods to treat cancer, such as radiation therapy. It is possible to cause damage to tissue, which is going to result into a fistula. But most importantly, to our cause and my profession, my specialty, obstetrics, the number one cause is trauma and injury during childbirth. So this will be primarily caused by prolonged obstructed labor. So prolonged obstructed labor, which is going to weaken tissues, most especially between the bladder and the vagina. Secondly, between the vagina and the rectum. Once that weakening of that tissue that lies between those organs I've talked about is weakened, then a channel of communication is going to be created where urine, instead of going through the urethra as should normally do, will sometimes leak into the vagina and will come out through the vagina. Equally, if it's the case of the rectum, where that channel has been formed and created, feces and flatus gas is going to leak again through that channel and be discharged through the vagina. So those will be some of the most common causes.
I see. Doc, I heard you mention that fistula in women. Does it mean that we have fistula in men as well?
Of course, yes, that's a very, very good question. So fistula, like I told you, it will be an abnormal channel, an abnormal hole in simple language, a connection between two different organs, and it will happen in men as well. And most commonly, what we have is a condition called anorectal fistulas. This will be primarily caused by an abscess, a boil in simple terms, around the anal area or inside the anus, just at the opening. So an abscess will form there. Now that will be an infection. That infection, if prolongs or causes enough damage, is going to bore a hole through the muscles of the buttocks, around the anus there. It's going to bore a hole through all the way up to outside the skin. So in those cases, you're going to have discharge of pus and fluids through that fistula. So you're more or less going to have two openings, the anal opening and an abnormal opening, which is communicating with the inside of the anus. And that is very, very common, especially in men. Women also do suffer from anal fistulas. Suffice to say, yes, fistulas will affect both men and women, and they'll be on different anatomical areas of the body, and they'll be caused by different causes. But of importance, the most prevalent is seen in women, as in our demographics. Women who are being subjected to prolonged obstructed labor and eventually resulting into fistulas of childbirth.
Wow, that might be, or let me just say, it is devastating. But then again, like we have said, so you have said that the most affected gender is women. Why women and not both?
Very good question. So again, to clarify, I will say fistulas will exist in both men and women.
Yeah.
And prevalently, men are more subject to having this condition, especially the perianal fistulas I talked about. But now with putting obstetrics into play, where women are the ones who are subject to childbirth. So that's solely a condition for women.
Yeah.
And that will be the most common fistulas we're seeing in women. So those will appear in women primarily because we're saying obstetric fistulas are as a result of childbirth, abnormal childbirth, where you had an obstructed labor and you labored for a very, very long time.
Yeah.
Now that sitting baby putting pressure on the pelvis, causing trauma to those tissues, affecting the surrounding tissue and resulting into boring of this channel, this communication we've talked about, either between the bladder and the vagina or the rectum and the vagina, which results into two types of obstetric fistulas. You're going to have what's known as the recto-vaginal fistula, and the other one is a vesico-vaginal fistula. One which discharges urine, the other which is discharging stool and flatus.
Okay. Now, are there any myths attached to people that are diagnosed with this condition? And maybe you can tell us some of these myths, especially that you interact with women that might or that have this kind of condition.
That's a very good observation. Of course, being in a remote area, Eastern Province, very vast, we get to see women with this condition coming from the peripheral areas all around. So I do interact with women who've actually succumbed to this very, very serious condition. Now, some of the devastating myths and really you are going to hear is no, this woman is cursed, she's cursed, or her husband was cheating on her while she was pregnant, or she's the one who was unfaithful during pregnancy, is what resulted in her having this condition. She's been cursed, or she's not been blessed by her ancestors. Those are some of the things you're going to hear many times. Yes.
So cheating doesn't bring fistula?
That's a very good one.
Yeah.
Definitely not. So it is all scientific. It is a condition that we know is well studied, and it is a very, very devastating condition. And the stigma and discrimination that's going to surround that very devastating condition is quite significant.
Yeah.
And with it will come some of those myths, definitely.
Doc, I had a friend who told me that she actually underwent through a surgery when she was actually giving birth. And now I am thinking, what is the difference between, fistula and the surgery that is conducted to some of the women when especially giving birth?
Very, very good. A surgery during giving birth is one of the advancements we've made in as far as obstetrics is concerned. It is a lifesaver in many cases, saving both the mother and the child when it's done at the right time with the right intervention put in place. So there's a big difference between the surgeries that will be done and fistula. Most surgeries will be done if we feel there might be danger to continue this labor for both the mother or the baby. If there's a danger, imminent danger that's going to cause either trauma or life to the mother or trauma or life to the baby, we're going to intervene and deliver that baby via a C-section. That's the most common obstetric surgery we're going to do. Other small surgical interventions we're going to do are just there at the vaginal opening. We're going to perform what's called an episiotomy. This will not be in theater. This will be just there in the laboring room. This is in the event that the outlet, the vaginal outlet, is not enough to accommodate the baby to come out, or is causing some sort of tissue obstruction, or we feel that if that happens, the baby is delivered the natural way, traumatic events are going to happen, and the woman might have so sometimes we do perform a controlled cut just there on the vagina, which what we call an episiotomy. So those are some of the different surgical interventions we make during childbirth. Okay. While fistula, now fistula this is a condition which will come as a result of injury. What type of injury am I talking about? I've already said injury associated with prolonged obstructed labor. So what normally happens is the baby's skull, as it's coming down into the pelvis in the birth canal of the woman also has bones in front and behind. So now if for some reason the baby is not coming out due to an obstruction, due to whatever is causing an obstruction, be it the size of the baby or the position of the baby, now that pressure that the baby is causing onto that pelvis is going to cause pressure with the mother's bones. So the skull, the bones are causing pressure between that tissue. Now that tissue that's in between where that pressure is being caused is going to slowly get damaged. It's going to slowly get damaged, and the longer it takes, there's reduced blood flow just at that tissue. And when there's reduced blood flow, it's going to get damaged and it's going to die. And when that happens, when that tissue is dead, is when this channel, this communication, this hole is going to be formed, causing communication, either if it's on top, the bladder to the uterus, or if it's at the bottom, the uterus to the rectum, resulting in that incontinence after birth of urine or stool through the vagina. So those would be the two differences.
Okay. You had also pointed out the fact that fistulas is actually associated with stigma and discrimination.
True.
But then again, is there any systematic way in which such people are helped? Maybe at health facilities and maybe in the rural areas where they're staying at, because after the health personnel look at this person, they'll have to let them go to the society. So is there any systematic way that has been put in place to just help such kind of people?
That's a very, very good and important question. So like you said, MOH is aware of the significance and the devastation this disease is causing in our communities to our mothers. So in conjunction with supporting partners, at the top of that list right now is the Fistula Foundation, as you stated in your opening statement. So there is support that is offered to these women that seek these services, especially by our partners, Fistula Foundation, after treatment And after they've undergone treatment and therapy of this condition, it will be there sometimes it won't, but linkages are always made where we want to support these women. Because remember, they were in the community where they were stigmatized.
Yeah.
You know, this condition comes with it. Imagine you're leaking urine all the time. You've got no control of urine that's discharging, and it's coming out of the vagina.
Yeah.
Stool is coming out of the vagina in some cases. So imagine the smell that you might be harboring around you. So this comes with it. People avoiding them. Marriages have ended because of this. Husbands have left their wives because of this. Your friends will leave you because you're not attractive in that moment, for lack of a better term. Yeah. You are repellent, for lack of a better term. People will detest and try to run away from you. And because of this, many women find that they are out of jobs. They've got no social support, no socio-economic support. They're secluded and individualized, so they don't have much going on for them financially and economically. So as part of Fistula Foundation project, when these women are assisted with treatment which is surgery, there are connections and linkages which are going to be made. Some of them will be sent to trades to learn skills to help them find a foundation to build after that. It will be, support is definitely given to these women in many instances.
Okay. Now, is fistula curable for both men and women?
It is.
Okay.
It is curable.
Yeah, and any records of reoccurring cases that you have seen as a doctor? For instance, a person comes in and you say that they are cured, 3-6 months, they come back and say, no, I still feel this is what is happening, or I still pass urine anyhow.
Very good questions again. So yes, it is curable, and the cure is definitely surgery. No two ways about it. Surgery, reconstruction, repair of the damage or excision of the fistula, depending on where it is. As in the case of anorectal fistulas that I earlier talked about, a procedure called a fistulotomy is going to be done. It's basically removing that new channel, that new hole that has been made, and fixing it. As in the event of VVFs, vesicovaginal fistulas, and RVFs, rectovaginal fistulas, related to childbirth, these will be repaired. They'll be repaired. And if repaired and well done, the patient is cured once and for all. But you are right. There are recurrent cases which I have seen where a procedure was done and the patient comes back with similar symptoms. Many factors are going to affect how curable you're going to be, or recurrence. Many factors are going to affect that. Significantly is your immune system. How well is your immune system? Your nutrition. How well nourished are you? The extent of the damage. How big was the damage? The expertise of the operator who was actually doing the procedure. So all those factors are put into play. Nothing is 100% efficient and perfect. So sometimes we're going to have, due to any one of those reasons I've listed, a recurrence, and the problem recurs. But then I go to be subject to a much further evaluation and treatment.
Okay. Now, I want to find out what are the ages mainly associated to this condition. We can talk first about women, the ages that are really associated with fistula. Which ones are more affected according to your profession? Okay,
very good question. So women, number one, the high rate will be in childbearing women. Remember this, we said this condition of obstetric fistulas is associated with childbirth. Yeah. So one is women in childbearing age, but now to narrow it down further, it will be those that are more prone to obstructed labor. Okay. And these will be young women, very minors, mostly under the age of 21. These are going to be subject to trauma and injury during childbirth. Remember, one, they are very young, so psychologically they are not ready for some of these processes such as labor. They are not, some of them are not fully developed, and will not be able to conduct a routine vaginal delivery at birth. And you will find that many of these who are exposed to early marriages, getting pregnant early, they'll get pregnant, then they're in a rural area, they're told to deliver at home, they are laboring at home, labor prolongs, they're not able to conduct this delivery and prolongs for a very long time. This is one of the most frequently seen age group. So minors, especially first-time pregnant women.
Yeah.
Yes.
Should the community be concerned about this condition?
At the level we have reached right now, we are in a state where we're economically, socially more advanced and things are more progressive right now.
Yeah.
So to my understanding, right now, you, my sister, if we do fall pregnant at any point, we're going to seek health care very, very fast.
Yeah.
And as long as that labor you're in labor, you're handled by a professional in a clinic or in a hospital, chances of that condition happening are very, very low.
Yeah.
So as a community, the communities which are at risk right now, communities which are in the most peripheral areas, in Mugubudu, in outskirts of Chama, very, very far areas which are remote to seek health facilities.
Attention.
Yes, and where you have a situation where labor has prolonged, and it is after you've labored for more than 24 hours is when you're seeking medical attention. I think those are the ones which we're supposed to be concerned about more significantly. Okay. But as long as we seek medical attention, we go to the health facility in time, have labor conducted by professionals such as myself, I think we shouldn't have a problem of the sort.
Okay. Now, in terms of statistics in Eastern Province, how many people maybe were seen in 2023, especially when it comes to this condition as fistula?
Excellent. So in Eastern Province, so we do have this prevalence of this condition significantly. And we get to see them just at my hospital, Chipata Central Hospital. But lucky for us, Fistula Foundation trained, it's more of a specialty, treating this surgery, which has to do with fistula repair. So Fistula Foundation trained surgeons at St. Francis Mission Hospital. So the gynecology department at St. Francis Mission Hospital has a specific clinic just dedicated to fistula evaluation, diagnosis, and treatment. So we are lucky enough that we do have these conditions all around Eastern Province. We're referring them to St. Francis to seek specialized care. And we're lucky that we've been trailing data. As of 2023, we saw a number 100 women with obstetric fistulas related to injury during childbirth. About 100 who were all seen and treated successfully. Okay,
that's very good if they were treated. So we can say that we have zero number of fistula out of the 100 that were treated.
That isn't fair to say. That we have to go back to St. Francis, check their logbooks. We see their reviews of their patients that have been worked on, and we see what's the outcome has been. Okay.
Now we are going to take a minute to watch this video. We had taken time to actually go to St. Francis, and this is what we came out with.
Not so much is known about a medical condition called fistula, yet this affects 1 out of every 4 women who undergo childbirth. 43-year-old Rachel Daka gives her testimony of this condition.
Kuchoka kupeta uke so neta kunambula sa kupeta uke zondifusha ku nchita operation so panchita operation no tata kutebo kwala kubedi na mbo chosa tukozo sa lekeja so nanuja te ankoya kumuzi kapena ikaleke kupeza ti avuto yala ilieleke mpaka naola soti moto kazonitola soti nakuzonu konza ko soti na tinkela basi ilieleke mpaka nalomba. So it's no 15 years. Koma nenzawela kuno kuzonikonza. So kanomba kamba tinka chitatu kunikonza.
But health experts in Eastern Province are fully aware of the risk fistula possesses to women and are concerned about the increasing cases.
Fistula is just a communication between an abnormal one. So where you don't expect maybe the passage for the stool to communicate with the passage for the reproductive system. So normally we've got various classifications of what could bring about the fistula. So one of the notable causes is what we call obstetric fistula. So in obstetric fistula, we mean these are abnormal communications that may come about due to complications of labor.
The Eastern Province Health Office has also given an update on statistics on fistula.
St. Francis, I think we recorded some numbers, I think, with my colleague, and I can just try to reference some point. Like for 2020, we had actually recorded 52, which were successfully operated on. So this is a success rate. In 2021, I think about 38 that was successfully done. In 2022, I think 46 were done, which was quite an increase from the previous year. So currently, as we stand as of date, we have actually successfully operated on 9 cases. That is at St. Francis.
St. Francis Mission Hospital in Katete has been dealing with fistula cases.
You know, they come with them, more especially depression, social isolation, family discrimination, all that. So after being with them, talking to them, interacting with them, we give them hope. And the hope becomes complete after surgeries when they become better, when they are no longer leaking or wetting their beds or being wet when they are dry, when they are okay.
Juba Zulu, Chipata District, Eastern Province.
Yeah, so as you have seen for yourself, Doc, women are still facing this challenge, and this is what we are able to see. Now, my last question is counseling an important tool to people who suffer from fistula?
Very, very important. Yes, that's the most important aspect of dealing with this devastation of a condition that we have. So remember, firstly, when we talked about stigma and discrimination, imagine you're discharging urine and stool from your vagina. Now imagine how you feel about yourself, the amount of esteem it's going to take away from you, the psychological trauma you're going to have with that condition. So the first thing is many women don't come out. They keep it to themselves for a very, very long time. So some could go as much as, I've met women who have gone as much as 5 years, 8 years, 10 years with the condition and didn't speak out to anyone. So ours should be community awareness, speaking up about this condition. It is a reality. It is with us, especially for women that deliver at home in the villages, where labor, you don't know which direction labor is going to take. Some will deliver successfully. It has happened, but that's the problem. You don't know how your labor is going to be. It might prolong, and when it does prolong, you're going to be subject to such a condition. So the counseling, which we should start from, let's encourage all our women, let's deliver from the hospital to avoid problems of unattended to obstructed labor. If you have obstructed labor, it has to be dealt with immediately, most of the time by C-section. Secondly, encouraging our women that this is a normal condition. It is not witchcraft, you are not cursed. This is a condition that is with us, and it is as a result of this and this and this. We have to tell them, give it to them very, very clearly, and tell them that services are there to treat you and cure you of this very, very devastating condition. So counseling will be very key as we tackle this challenge.
Okay, thank you so much, Doc. You have heard for yourself, women, men, let's seek medical attention, especially when we have this condition. It is not just about fistula, but any other condition. So I have been your host, Jubel Zulu. We say thank you so much for joining us from the TV crew. Every one of us, we are saying bye-bye for now.